All right. I think that was probably a pretty abrupt transition. But hello, everyone who is here. Welcome to my very first stream using like stream equipment and not just the YouTube app. So we may experience some technical difficulties, and I appreciate you. Just let me know if we do. It's going to be fine. If you are here today, we're going to talk about the CDC and how they came up with the worst Christmas present I've ever experienced and decided to redo their guidelines, but only do it to healthcare workers. Now, I will say 4 hours ago, they really messed me up and threw a new update out there. But honestly, the part that I'm really mad about, which spoiler I'm mad about, is that they're more making people work while they have COVID, or at least they're presenting it in a way that I think hospitals are going to be able to swoop in there and be like, hey, you can just work while you have COVID. It's totally fine. And we'll get to that at the end. If you're watching this live, hello. I see everybody. All sorts of people are here. Hi, Cheryl, Kate, Lori, Ruby. Oh, everybody. Hi. Thanks for showing up. I was nervous. I was like, I haven't done one of these in forever. What if no one comes? I'm going to try to keep it somewhat structured. So I have a list of points. Hi, Courtney. And then I'm going to, if you're watching this on the replay, I'm going to timestamp all of it so you can watch all of it below. So today's primary topic is going to be, all right, let's see if we can do this, guys. Let us see how the CDC, how to make healthcare workers even angrier. And the CDC nailed it flawlessly. So on our lineup of things we're going to be discussing today, we're going to talk about what did the new guidelines actually say, because I had a poll on, or a discussion box on my Instagram yesterday, and a lot of people didn't like, there just seemed to be general confusion about what the guideline actually said, which makes a lot of sense because the CDC doesn't come out and just say anything in a very simple way. I had to search for like a weirdly long amount of time just to figure out what the normal isolation precautions were. So that's odd. So we're going to talk about like, what does the guideline actually say? 2, who is affected by the new guideline? Like who counts as a healthcare worker? 3, what the general population recommendations are. And obviously that changed as of 4 hours ago. So we'll kind of touch on that. 4, why did this make healthcare people so upset? Because I've also heard from the flip side, I follow, you just follow random people on the internet, and I follow a good amount of people who are like, oh my gosh, like healthcare workers complaining again. And I was like, oh no, friend, let me tell you why we have every right to complain. So we'll talk a little bit about that and the history of how people have just kind of felt trampled on during this pandemic. We'll talk about in number 5. This one's actually kind of funny. What else they recommended in the guideline? Just wait for it. It's going to be pretty good. 6, how I am most worried that hospitals will manipulate the guideline, because this is the primary thing that worries me. If we're being honest, I'm not super upset that they came out and they said, hey, you're going to have to quarantine for less time or blah, blah. The thing that makes yes, that's very annoying. But like at the same time, a lot of hospitals, there were a lot of barriers there. So we'll talk about that when we talk about like what's going on right now. A lot of hospitals aren't providing testing. So it was causing people who wanted to actually go back to work, who had no symptoms, couldn't go back to work. So I think that part is fine. The part that I hate is if you have COVID, you might now have to go to work. But like I said, we'll get there. Then we'll talk about crisis plans, just because we have those now. They exist. And on one hand, I guess it's good they exist. Like we have a plan, but on the many other hands, it's like when you read it, it just makes your blood boil. So deep breaths. We're all going to be fine. Everyone should probably have like a stress ball for this conversation. I recommend it. I have my daughter's glittery pen, so I might just twirl it. It's going to be fine. And then we'll talk about the impact on public health and final thoughts. And then we'll have a quick Q&A or just general rant and discussion if you guys also have thoughts. Yes. Let's see. Cameron, I agree. It is some BS. What if you don't want to work while you have COVID? That is why we are going to be discussing this. I've seen a lot of comments like this too. This is why I can't wait to leave this field. It's just like taking people who are already frustrated and then kind of stabbing them in the back when they already feel like what is happening. Okay, so let us go through. Is everyone thoroughly impressed that I managed to actually get those 2 things up there? Please just tell me you're impressed. Chapter 1, which is, what do the new guidelines actually say? So in case you do not live on the internet like some of the rest of us do, you may not have known that the CDC on, oh gosh, the 23rd. So what was that? Thursday came out like right before everything closed down for the holiday. They came out and they said, hey, just so you know, we came out with a new Courtney has wine. That's excellent. I should have had that too. Actually, I'm getting over the plague and I don't feel like wine would be good. They came out and they basically said that, hey, for healthcare workers, you do not anymore have to quarantine for as long or isolate if you have had COVID. And the difference between those two, just to kind of like lay the groundwork, because it's not always clear, quarantine is if you have been exposed to the illness, but you haven't necessarily caught it yourself. So they kind of like lock you in a room. Normally, I feel like in the beginning, we did a lot of that where people were like, oh, you were introduced to it, let's go hide you away. And that's kind of fallen a lot to the wayside. Obviously, you would be exposed to it constantly at work. And this would be more of like an exposure if you didn't have proper PPE. And then isolation is once you have had it, if you've had it, how long are we going to lock you in a room by yourself? And I'm really resisting the urge to talk about how that several times during this pandemic, I won't lie. I was like, maybe if I just get COVID, I'll be locked in a room by myself and no one will be able to talk to me. My husband will have to keep my children alive and they will leave me alone. But that came out on Thursday. Now, hold on one moment and we are going to try to look at the actual document. Just bear with me for 1 second. Let's see if we can find it. We're going to stop that. I YouTubed how to do this morning, so everything is going to be totally fine. My poor sister, I was like, I think I'm going to go live and I think I'm going to use a new streaming software. She was like, wait, what? I was like, it's going to be fine. Everything's going to be fine. Okay. Hopefully you can see this. Oh, good. And you can still see my face. That's fun. I don't even know how I picked that. Okay. COVID-19. This is what came out, like I said, on December 23rd. Let's just review it on a very surface level for this moment. So I will read it to you just in case you don't have it in front of you. Due to concerns about increased transmissibility of the SARS-CoV-2 Omicron, which by the way, my mom calls it Omicron and it sounds so much better. Omicron. So we might call it Omicron from now on. I'm just warning you. The guidance is being updated to enhance protection for healthcare personnel. So this is not for the public, guys. This is for us. This is for us that they're doing this, patients and visitors, and to address concerns about potential impacts on the healthcare system given the surge of SARS-CoV-2 infections. These updates will be refined as additional information becomes available to inform recommended actions. Thank you. That makes it sound so nice. What have you possibly done for me now that you've phrased it so nicely? So what are we going to do now? We're going to ensure that SARS-CoV-2 testing is performed with a test that is capable of detecting blah, blah, blah. Okay, that's great. You're going to actually use a test that works. Super. Updated recommendations regarding when healthcare workers with SARS-CoV-2 could return to work. That's interesting. They definitely mean when we're better, right? That definitely means when we're better. Only. The definition of high-risk exposure would be updated to include the use of a face mask instead of a respirator. So you need less by the healthcare provider if the infected person is not wearing a face mask or glove. And additional options would allow asymptomatic healthcare workers with a higher risk of exposure, blah, blah, blah. Basically saying like you can go back to work earlier if you would like. This is where it gets truly interesting. So let's just take a step back. I think the way this is all going, I think we are moving more into the territory of something of COVID less becoming like, yes, it's a pandemic, but I think it's going to become something that we just routinely see all the time in our community. I think it's going to turn endemic. I do believe I have something for that. Hold on. Here we are. Epidemic versus pandemic versus endemic. Let's look at what the three of these are, because a lot of the things that people said yesterday when I was having the Instagram conversation as well was, but Liz, we need to move away from this being like a crisis. And I was like, I totally get you. That's why I feel like they should have just come out with this as a across the board. This is the way we're going to do things now. Like, why did you select healthcare workers? That's where my issue is. But let's look and see epidemic versus pandemic versus endemic. This is kind of what I think what angle they're coming at it from, to say we're trying to transition from pandemic into something we see all the time. So an epidemic, in case you're not familiar, is it, because I wasn't until yesterday. I thought epidemic and endemic were like the same, but turns out they're different. Epidemic is a disease that affects a large number of people within a community, population, or region. So this would be like when, if COVID first started and when it was just isolated in its one area, like started in Wuhan. Pandemic, an epidemic that has spread over multiple countries or continents. This is when it started going over into, where did it go? Italy, maybe? I don't even remember. Guys, can we just talk about the fact that when COVID happened, this is going to be a little, I'll tell you my side tangent in a minute. Endemic, an illness that belongs to a particular country or people. It's still harmful, but considered part of the normal scene. So that's like the common cold, the flu, still not good at all, but it is now something that is like, it lives here now. Side story really quick. So shall we all remember? You can go back and you can watch the video on my YouTube channel. I should take it down. We were going to Disney World, to the week of like when COVID really started to become a thing. But like we started on a Tuesday. I think we were there for like 3 days with my in-laws. And on the one day, it was when COVID was just like the inklings were starting and people were like, this is going to be fine. And then like the 1, 2, 3 days of like, this is not fine. So we were there. And like, I remember people were like, oh, are you still going to go? Even though there's COVID, and we were like, oh yeah, we're still going to go. Like, it's totally fine. It's just like some weird cold thing. And then by the end of like, we were there for like 2 days. And then at the end, they totally pulled everything. And they were like, we're shutting Disney World down. So that was good. I saw that escalate very quickly. So I don't know why I told you that story. I hope you enjoyed it. Where were you when the pandemic happened? And then life was, we should do a whole separate, I feel like we need to do a whole separate like live streams or something. My sister's laughing at me because I'm on like 12 tangents. I was like, I'm not going to go on tangents. Here we are. About like where we can talk about what we've seen in the last 2 years, because it's been really, really rough. And Mary, I just saw your comment. And yes, I think administrators are going to actually love this, because this is basically giving healthcare administrators a way to, be like, hey, we're going to go for it. And now you have to come to work when you have COVID. So I totally agree. This is where my biggest frustration is. And we will get to that. Okay. So back to this. What were we talking about? With everything, I think, where were we? Do you even remember? I'm looking at my sister. She's ignoring me. As it becomes endemic, talking about how it becomes back into like the regular population. So sorry, I should have made notes. So as this comes in, this is the part that I struggle with. At first I was like, this is totally fine. Everything's fine. Like, I understand that it's frustrating that healthcare workers are being targeted, because by the way, all of this was only about healthcare workers, not like it specifically targeted healthcare workers, which is where the rage came in. Cause I feel like a lab rat. So at first I was like, maybe people are overreacting. I won't lie. I kind of thought that. I was like, oh my gosh, guys, like we have to, like, I don't work actually in a hospital anymore. So, but I was like, okay, you have to quarantine for a little bit less time if you've had an exposure. This is fine. And then I looked up the document on the internet and I was like, oh, because this very interesting part right here, work restrictions for healthcare providers with SARS-CoV-2 infection and exposure. So let's talk about when healthcare workers have an infection. 7 days, you have to be off for conventional. So like in a normal world, 10 days or 7 days with a negative test if asymptomatic or mildly symptomatic with improving symptoms. I was like, oh, that's a loophole. Just in case you were wondering, the CDC considers mildly symptomatic as not hospitalized. So that's a jump. So you're either mildly symptomatic, in which case you are not hospitalized, you are moderately, in which you are hospitalized, but your oxygen is above 94%, or you are severe, in which case you're like intubated. So this leaves the door open for now all of the administration to come through and say, well, as long as you only have mild symptoms, AKA you are not, your oxygen is above 94, you can come to work. We move on to, so that's just normal. That's like if everything is going to plan. Then we go into contingency, which is when we start saying, you have to come to work within 5 days. if asymptomatic or mildly symptomatic. So like now we've even shortened it more. We're like, you just tested positive, but why don't you just come right on back in 5 days? And then we go to crisis, which we'll have a whole section on crisis. But crisis is there's no work restrictions with prioritization considerations. Example, asymptomatic or mildly symptomatic. So maybe it's like, who needs less oxygen? Like, can you just strap a tank to your back? Like, and can we walk down the hallway? Or was like, is it going to be a really big problem for you to wear your ventilator while you're working? But do you think you could do it? Great. Could we lower you to BiPAP? Could we get you to BiPAP to get you to come to work? So that is a little bit of the background. Like I said, my biggest struggle is mostly with the fact that they have come out and made these guidelines, and all the hospitals are going to, I feel like, just eat it up and be like, well, this is great, because it completely takes like everything right now. I feel like hospitals are, you can still kind of be like, no, I'm not coming to work with COVID. And this just removed all of that out from under our feet. And we have no ground to stand on because the CDC literally came out and said it's totally fine if you go to work with mild COVID symptoms. I'm going to go down a brief tangent right now before we move on. I know you're probably like, once again, about some people were like, well, how would this even get, like, how did this get out here? I'm just going to throw it out there. Like, I think I think we all know there is a healthcare worker shortage at the moment because people are not treated well. Someone pointed out on my Instagram yesterday, it was very wise. They were like, isn't it interesting that this came about right after a lot of nurses are really upset because of, so if you are a nurse and you work at a hospital, you are working next to travel nurses who then quit their jobs and are now traveling and getting paid like 3 times more. So that's been a huge cause of strife. And a lot of people are leaving for that. A lot of people are leaving because they just feel like stepped on and like this, they're just over it. But when you're working next to someone who's getting paid 3 times more than you, which is definitely more than the counter argument to that is people are like, well, you have to pay for their, their healthcare and their, like all their other things. I'm like, no, there's no way like it's that much of a difference. But that was going on. And now that was like really boiling up, was the whole like cost of how much we pay nurses and how much we pay healthcare people in general. And then this all of a sudden showed up. So I was like, well, this is something that everyone's going to be more mad about. So that's interesting. But also insurance companies, a lot of people were like, how is insurance letting this happen? Interestingly enough, insurance companies, if you go into the hospital and you get sick from the hospital, so let's say your grandmother was admitted and she's been there for like, I don't know, 15 days. So long enough that she obviously couldn't have brought anything with her from home if she tested negative when she came in. And now grandma gets COVID while she's in the hospital because her nurse maybe had COVID. The hospital doesn't, they have to pay for the entire bill now. Insurance can say, oh, you acquired this at the hospital. It's like pressure ulcers. I feel like when insurance company people lie awake at night, they dream happy dreams of like pressure ulcers and falls and things like that, because literally if those things happen, then they can say, oh, all of this, no, none of this was the patient's fault. This had nothing to do with the fact that grandma fell and broke her hip and like maybe has double pneumonia already. This is all because you gave her COVID. So I highly doubt that the insurance companies were very sad and probably even pushed this right along. I have my stress swivel pen when all of this came out. So let's see, Bianca, your take that this thing is going to become an endemic is actually refreshing, maybe a light at the end of the tunnel. Yeah, I mean, I think it will be. I think it's interesting because coronaviruses are normally not that bad. So I'm hoping that it kind of develops enough. Like it'll be interesting to see as this Omicron data comes out. I'm sorry, I couldn't help myself. Is it I know it seems like it's a lot more transmissible, but maybe is it less severe? That'll be interesting because that almost makes me think it's trending towards a more common coronavirus. When we used to swab people in the hospital for coronavirus and it like for a respiratory panel and it came back as coronavirus, you were like relieved. You were like, oh, that's like the least harmful of any of that. I would almost rather you have coronavirus than like rhinoenterovirus or RS, certainly more than RS, like it's safer than RSV usually. So this brand of coronavirus that we have now, I hope it will just turn into one of its really boring cousins that does honestly not a whole, like is just a common cold. Let me see. So relaxation's head, benevolence is out the window, non-maleficence is no longer the do no harm. And we're taking COVID to the bedside with people that are immunosuppressed. Yeah, that's it's a whole mess. Like I can't even imagine the guilt personally. Like if you went, one, I don't want to go to work when I'm sick. Like that's ridiculous. And now hospitals are I mean, we're kidding ourselves if we think that, when you go to your manager and you're like, well, I've already been sick, I'm out of PTO. They're going to be like, well, you have to come back. And you're like, but I literally have coronavirus that I probably got at work. And they're going to be like, well, you have mild symptoms. It's totally fine. You only have muscle aches. Can't cough in a lung, all of that stuff. It's going to be fine. Arlene said, then he should work 3 times harder. Yeah. And there's a lot of, we'll do a whole thing maybe about travel nursing and how like within all of this, like it has caused so much strife. And I don't blame any people who travel because like, why wouldn't you go and make that much more money? Let's see, Annette, I am home with COVID day 5. Oh, I hope you feel better. I got this from work. Not only do they take my PTO, but they also have no RVUs. Oh my gosh. So I'm vaccinated and boosted. I will not return them until my symptoms are resolved. That's ridiculous, guys. So and I hope you feel better. What Annette's saying is that she has to use her own PTO, her vacation time, in order to pay for it. And when you are, I'm assuming you're, I think you are, WeChat on Instagram, a nurse practitioner or something, and an RVU is like your productivity. So based on what patients you see, you get paid. So, obviously you're not getting you're basically getting paid a whole bunch less. Plus they're eating all your vacation time. Okay. So that was our introduction. Wow. I managed to make that a lot longer than I planned, but it's totally fine. So we've reviewed our little table of what actually makes me mad. If there's any questions at this point, by all means, please let me know. You can just leave them in the chat whenever. Let's look at who is affected by the new guidelines, because I thought this was also interesting because yesterday people were like, look, it's not like outpatient people, is it? Oh, friend. It's even the dentists. They even threw the dentists under the board with this one. So, and I'm going to have all of these things that I looked at to use I'll link them all below. Healthcare professionals, they defined it for us, refers to all paid and unpaid persons. So they're going to make the unpaid people. Yeah, you volunteer, you're going to be fine. Come on in. Persons serving in the healthcare setting who have potential for direct or indirect exposure to patients or infectious material, including body substances, contaminated medical supplies, devices, blah, blah, blah. Healthcare providers are included, but not limited to emergency medical service personnel. So like EMTs, paramedics, nurses, nursing assistants, home healthcare personnel, physicians, technicians, therapists, phlebotomists, pharmacists, dental healthcare personnel, students, and trainees. That I thought was very interesting. So your school, if you are a nursing student or a med student or a PA student, now you cannot say, your school could come out and say, you can come to clinical, you can come to school, even if you have COVID and you're still showing signs and symptoms. Whereas before, I feel like they would have balked from that. And now you have no ground to stand on because the CDC has said, oh yeah, you're a healthcare student. You're going to be just fine. Suck it up and go. Unless you're on oxygen, then you can't go. But who knows? Unless it's a contingent, unless we're working up that chart, in which case they just say, just go. Don't even think about it. It's going to be totally fine. It's character building. And basically everybody, healthcare providers are not clinical laboratory personnel because they're assuming hopefully everything is contained well. I don't know if they have to go to work or not. And then it goes on to define immunocompromised for us, which now you have to be more immunocompromised to be considered immunocompromised is essentially what it's saying. So that's kind of who we are referring to. Anybody, an inpatient, outpatient, dentist. I don't know if it talks about eyeball people. Did we throw the optometrists under the bus, or are they living in a world of their own? They live in their own world in the hospital. They're like the optometrists. I feel like eyeball people, I could not be them. Eyeballs freak me out. But they also get they never had to do call in the hospital. It was just very interesting. Let us see. We are on chapter 3. Let's look at the general population recommendations, which did change today. So let me just disregard literally all of these slides that I have, and we will, let me see. We'll stop sharing that. We'll go to this one. I hope you enjoy me talking to myself. I do it all the time. And everybody I work with, both in my whole life as a waitress, as a nurse, everyone's always like, who are you talking to? I'm like, me. Like, oh, okay. um, let us see. Here we go. Here is the new update that they released 4 hours ago. So basically, what they said is before they told you if you were exposed, you should go, or if you had it, you should stay home for 10 days. That's what we've been working with. Now they're saying you can go down to 5 days if you don't have symptoms. If you have a fever, you should still stay home. This is, again, kind of like I said, this is not the part that makes me mad. The part that makes me mad about this whole thing is the little phrase that they snuck in there about like where there's no definitive anything. They're like, mild symptoms is fine as long as you're getting better. It basically just goes on to say this whole thing. I did find a funny statement that they made within it. So honestly, from the way I look at it, I feel like either they made this recommendation because they realized people were so annoyed, or by, the fact that they came out and they made this huge thing on the 23rd, or that like this was all coming anyway. And we are moving from a pandemic to having something be endemic. So this was expected. Like I said, that was never the part that I personally took offense with. If you do, that's totally, absolutely fair. All your feelings are valid on this, and let us know if you need a space to vent them. Go for it. I certainly am. But this, like I said, that update today, it didn't really do a lot for me because the part that I'm mad about is how the hospitals are going to manipulate with us. Arlene says, I work on the floor now and they just sit around while we work our butts off due to the management breathing down our necks. That is horrific. And I am sorry. So Arlene's talking about the travelers. So obviously travelers, it doesn't really matter what it does, but at the end of the day, they're there to do their assignment and they aren't going to see that manager again. And they're going to go, and the manager's not going to fire them because they desperately need people on the floor. Annette said, I'm hearing that both this will be endemic, but now that children are more susceptible to Omicron, maybe we'll have a higher rate of natural immunity. That would be a delight. I really think I don't know if I had it or if I had the flu, but I didn't go get tested because the testing place around me they do COVID mixed with the flu swab, and I would have to pay for the flu swab. And I was like, I just don't care. I'm like the people that we're just all at home and it's passing through our whole house. More susceptible. They've always been susceptible. Bonsai baby, are you talking about who are you talking about? Cheryl said, I have COVID since December 12th and I'm still sick. I'm sorry. I'm going to be starting NP clinical in January. So far, the college has me isolation while symptomatic. I hope they don't make me go to clinical. I hope so too. Let's see. Sam said, sorry, I'm confused by the new CDC chart. Is the conventional contingency crisis level based on hospital facility staffing levels? Yes. And that is where it's going to get very interesting because we are already technically in crisis in almost every area. If you live in a place where you do not have adequate staffing. So I have that. I forget in what section. We'll get there. But basically, they did come out and they said, what counts? Oh, it's when we talk about the crisis. What counts as crisis? And this is where I really my heart just went oh, because it said a crisis, and we'll double check when we get there. A crisis is you can be in crisis staffing if you do not have adequate staffing on your floor right now. And it is affecting patient care, which I feel like is a lot of different units. So hospitals can look at that and just be we're in crisis. And the CDC says when you're in crisis, you can come to work with COVID. And that we just kind of spoiled the whole thing. That was kind of my entire that was the grand finale, but everyone just forget it. And we're going to get to it in a few minutes and act really shocked when we talk about it again. Okay. But Sam, that's a really good point. Leah said, my son got COVID and gave it to me. I'm on day 11 now after my positive test. I was vaccinated and still can't imagine going to school before day 10 of isolation was over. I know. I know. People are sick. Also, I hope you feel so much better. That was really rude of your son to give it to you. Whatever I just had as well, my children gave to me and they still made me take care of them. And when I was sick, I was like, I don't feel good and this is your fault. But I agree. How are you supposed to go back? And I feel like and this might have just been different places. Like you'll have to let me know in the chat, like what your institution did when you got sick. But before, if you got COVID from work, at least they were kind of like, well, we aren't going to make you come back. Like there's not going to be as much pressure. Yes, we're going to call you 12 times a day and be like, can you pick up this shift? But like you don't have to come back or risk losing your job. And now they could kind of hold that and be like, well, yeah, you're sick, but like come back on in. Everyone says it's fine. Ashley said, I love your content and take on this. Generally do appreciate. I've been a nursing assistant at hospital. This whole thing has been horrendous. Thank you. And I'm so sorry. I cannot imagine working inpatient, and all of you that are, like, just massive hats off to you. Like it, kind of drove me into the ground, and I only worked outpatient as we see. Leo lives in Pennsylvania too. Hello, neighbor. Let me see. And Bonsai Baby is saying children more susceptible. Children are still susceptible. Bonsai Baby, you're right. This one, sometimes I think they were more like asymptomatic in the very beginning with the alpha variant. It seemed like they were not getting it as much. And I'm not like, I don't follow this honestly as religiously as I used to. When I worked in primary care, I followed it really, really well so I could give my patients information. And now I'm just frustrated and annoyed at it. And I'm like, I'd like you to go away. And to be honest, it doesn't affect like my patient education at this point because I'm working on like totally different stuff. So I have not stayed up to date. Like I no longer stay up to date with all the recent stuff, but I think from what it sounds like, this is infecting children more than when in the very beginning in alpha, it just was not. But who knows? They might have been asymptomatic. And yes, Aaron, so sick nurses have to go to work because the hospital is not staffed sufficiently. That is now our problem. Got it. Good. Annette said, yeah, they stopped elective surgeries and that staff is being used as support. Yeah, I feel like this is all just going again. And then I kind of wonder, I'm like, when is this just gonna, I just want to bury my head under sand. Darnell said, is adequate staffing not a moving target? Staffing would be based on volume, correct? Yes. So, and some places, like I know some places are just like totally strapped. They have no nurses. Other places I've heard, but then it's hard to know, like, what do you hear? You hear that people are just like, that their unit's totally fine. It seems to kind of vary based on where you live. I don't know. Like, it is. CVS charged me $160 for a test. I didn't have $160, so I took a few days off and went back to work. And this is a whole different tangent for a different day. I had so many patients in primary care, which if you haven't watched my healthcare deep dive series, we talk all about how our system is impossible. So I'm just going to say shamelessly promote that. I will link it in the description. It's talking all about how our insurance system doesn't work and you lose access to care. But yes, I had most of my patients they didn't want COVID tests. That was when I lived in North Carolina. Most people by me did not believe in COVID. So they just didn't take the test. But like that just leads to even more deep breaths. Okay. Let us see where we are on our schedule. Well, we've done that. Oh, we defined healthcare workers. We talked about normal isolation. Oh, we were going to talk about the contra. This was funny. Hang on. Let me get rid of this other thing. How do I get rid of that? There we go. Okay. Guys, I'm actually kind of surprised. I don't know why this is supposed to have a navy blue background and it doesn't, but overall, knock on wood, I'm kind of impressed by my ability to navigate this. I'm not gonna lie. So here, I just threw this in here because I thought it was funny. For healthcare professionals, if you're a healthcare professional who thinks you had COVID-19, you should follow the same exact recommendations as above. And this is talking about like the general population, like do not go to work, do not do anything for at least 10 days when you see the return to work. Obviously today changed that, but I thought this was really funny. I was like, you forgot to update that on your website, CDC, when you said healthcare workers do the exact same thing. And then you came out with a guideline saying, never mind, actually do nothing of the sort. You are special unicorns and you have special immune systems that are going to be just fine. Why are people so upset? So in case you are not working in the healthcare sphere, I just thought we would throw this out here and give you a little bit of a background. This is making a lot of healthcare people feel like they are just being trampled on. Like this entire pandemic, I feel like has, first of all, it's taken people about like from we didn't volunteer. I think this all goes all the way back to like the healthcare heroes thing, which is why in the thumbnail it was like healthcare heroes with my that's what I hoped my stars implied. Because I never signed up. And I think there was this weird, everyone was like, oh, well, this is your job. You have to go to work in the middle of a pandemic. You have to figure out all this stuff and like get exposed to it all the time, especially in the beginning when it was just so terrifying. Like, and people were like, well, that's your job. And you're like, no, I signed up to take care of people and in return, like in a safe environment. Like I never said I was going to fall on this sword and go take care of, excuse you. Bless you. I mean, go take like, I never said I was going to go to work and then risk my life or my family's life. Like that is not what I signed up for. I am not like, why are healthcare people assumed to be like these all self-sacrificing things? And I think it comes back to like, it's a calling, which I also dislike. Shocker. Like, why can't healthcare just be your job? Like, I feel like that's a huge weird thing that we have in nursing, that like nursing has to be a calling. I'm like, or you could just view it as like a stable, always in demand job. And that's totally fine too. But like this entire thing, it's been like, oh my gosh, like, thank you, healthcare heroes. Like, thank you for like going in. And I know so many other people work in all the other stores that had to stay open, supermarkets, Target. Like, I'm not trying to say like healthcare people are the only ones who are getting stepped on, but it feels like from the very beginning, it was just like, well, you still have to go to work when most other people didn't have to go to work. Yes, a lot of people did, but like you still have to go to work. You still have to figure this out. You still have to expose yourself. And then at first people were like, oh, like this is nice. Like, yay, we're going to go bang pots for you. That was very nice. If you lived in a place that did that. I lived in a place where people are like, you are a lying piece of poo. This doesn't exist. As I was like, talking to patients dying in the hospital. So like I said, we need a therapy podcast type chat. But then the CDC came out and they said, oh, well, we're running out of PPE because we didn't really ever plan. I know everyone said like, hey, you usually have a pandemic every like 100 years and we were due for one, but we did not plan for that. And so then they said, and if you have a mask, since we're out of them and you wear it in the hospital, you're going to be fired. So that was the first, like, that wasn't the CDC, but that was just hospitals saying, you're going to scare people if you wear those. I remember when like everyone in the airports, like, do you remember that when people would like wear masks and you like, I remember being in the airport, my mom had a surgery and I was in the airport and I wasn't wearing one, but it was in the very beginning, weeks before, the chaos started. And I was like, why are these people wearing masks? Like, you're being a bit dramatic. And I just look back and I laugh because now here we are. So in the beginning, you could get fired from your job for wearing a mask because it was seen as inciting fear. And then wrong one. Man, I shouldn't have said anything earlier. We would have been fine. And then they came out and the CDC said, hey, we don't have masks. You should wear them now. We have decided that we have moved past fear. We've acknowledged that this is now a problem and you should definitely wear a mask. We ran out of them though, but do you have a bandana? Because that's going to be just fine. Which, like I said, when the CDC comes out and says something, hospitals can now lean on that. And they can be like, oh, this is what we can implement because you are literally the Center for Disease Control. And I hope that's what it stands for. I think that's what it stands for. They're going to lean on that. So when you say you can wear a bandana, the hospital can now make someone come to work wearing a bandana. And if they don't feel safe, that's their problem. It's not the hospital's problem. So this is where it all kind of comes back to it. And then, they came out and they said, I know for your entire career, we have, you only wore the N95 once, you only wore the disposable surgical mask once, but we're kind of short on them. So now it's also totally fine to clean them and reuse them. So a lot of these things. And then everyone got really angry at all the healthcare workers who, were saying that this is real. And the population was like, it's not. We were like, it is, it's not. And the hospitals were like, if you talk about this, we'll fire you. So then it made it really difficult to try to convince the general population that like this was happening. But a lot of people were experiencing a lot of understood trauma because this was like really, this is hard. But again, you can't talk about it because you'll get fired. So like, just a lot of these things, a lot of lack of staffing. People have been working. There's no PTO. A lot of hospitals are saying you can't even take your PTO. So it kind of has felt like we've been the guinea pigs and the ones who have just kind of had to keep on keeping on this entire time. And then for the CDC to come out and make a statement saying, hey, nothing changes for everyone else except for you, kind of feels like you're being stepped on by a giant shoe, like in my thumbnail. Let us see. Annette wore a N95 for weeks. So did I in primary care. I had one. I covered it with like either my cloth mask or my surgical mask. We're just gonna go there, guys. We're not going to get into the COVID booster or anything like that because that's a whole, or the like vaccine thing, just because that's going to take us like way off of track. I will, Arlene, I see your question and everybody else. So I will leave after this, I will leave in the description some excellent people who are on TikTok who explain all of your questions way better than I could, because I am not, they're much more eloquent about it. Leslie says, I can see why many in healthcare would leave. I totally understand. Yes. Annette, there is not enough therapy. I totally believe you. Bianca said, a nurse I follow on social media posted that the CDC made us feel like sacrificial lambs for Christmas. And I can't shake it. It really did. It felt like they were just like, I could not care less about you. And that is like, literally, that is exactly how it felt, was like, who cares? Basically, it felt like you were just bowing to the hospitals and the big, who were saying like, hey, we don't have enough staff. And the CDC's like, I got you. They can go in while they're sick. Like, kick me while I'm down. Not like this has already been a kind of bad year. They just went for it. All right. So let us see. Oh, this one's fun. So what else was recommended? This is more just as like a light, gentle reprieve in the middle, because this is getting a little bit, it gets a little bit heavy. So let's look at what else in this guideline. They said you can go to work while you have COVID. You're going to be fine. But let me see. You should also do all of these things. This is like contingency thing. You should cancel all non-essential procedures. You should attempt to address social factors that might prevent healthcare providers from reporting to work, such as needing transportation or housing that allows for physical distancing, because apparently the CDC thinks that your hospital is going to pay for a new house where you can physically distance from your family members. So that's going to be fun, particularly if the healthcare provider lives in a house with individuals with underlying medical conditions or older adults. So I, for one, if I worked in a hospital, I would be telling them right away, like, I live with, a lot of people, and we certainly do not have enough rooms to all have our own room. So I'm sure you will be fixing that for me, right? Identify healthcare personnel to work in the facility. Identify additional healthcare personnel to work in the facility. Just go find more people, hospitals. Before, duh, like, haven't you thought of that? Be aware of state-specific emergency waivers or changes to licensure requires. So, hey, why don't you go hire more people? But just so you know, you have to license them in your state first. Thank you, CDC. Thank you. As appropriate, request that healthcare providers postpone elective time off of work. Oh, so the CDC also thinks, what your problem is you're giving people who have worked for like 2 years straight, you're giving them vacation time. That's not okay. And for the few people who still have PTO because they haven't burned through all of theirs by being sick with what they've probably caught at your own healthcare where you work, you definitely should not let them have vacation. And that was, then it goes into like testing and other things that people should have. And then if you scroll down, it has a section on coping with stress. This is for us, guys. The COVID-19 pandemic has had major effects on our lives. Many of us are facing challenges that can be stressful, overwhelming, and cause strong emotions in adults and children. They hear us. Public health actions such as social distancing are necessary to reduce the spread of COVID-19, but they can make us feel isolated and lonely. I should have had sad music on, and can increase stress and anxiety. Guys, did you know you might be stressed or anxious? Shout out to everyone else who joined the Zoloft train during the pandemic. I feel like Zoloft, like everyone who makes antidepressants is like, yes, never end. Maybe they did this to us. You should learn to cope in a healthy way with stress. The people you care about and those around you will become more resilient. So stress can cause the following things in case you have not experienced it in the last 3 minutes. Obviously, I have. I can't stop twirling my pen. Feelings of fear, anger, sadness, worry, numbness, or frustration. Changes in appetite, energy, desires, interests, difficulty concentrating and making decisions. I feel like this is describing me. Difficulty sleeping or nightmares. Physical reactions such as headache, body aches, stomach problems, skin rashes, worsening chronic health problems, worsening mental health conditions, increased use of tobacco, alcohol, or other substances. But don't worry, it is natural to feel stress, anxiety, grief, and worry during the COVID-19 pandemic. There's nothing wrong with you. It's normal. Below are ways that you can help yourself, others, and your community manage stress. Are you ready? Take breaks from watching, reading, or listening to news stories, including those on social media. Get off of social media. Do not look at the other angry nurses. Do not look at it. They don't know what they're talking about. They're just stressed. They need to follow these rules. It's good to be informed, but hearing about the pandemic constantly can be upsetting. That is true though. And if you're on social media, like I've changed my social media so much that now it's just like mostly like crafts because that doesn't stress me out. So do that. But also, I just think it's interesting that they're like, don't go there and find the other angry people. Consider limiting news to just a couple times a day. How long do they think you're on there? And disconnecting from the phone, TV, and computer screens for a while. So don't be on your phone all day. Then you'll be totally fine. You will forget that we have made you go back to work with COVID. Take care of your body. Have you tried taking deep breaths? Oh, that makes me want to punch so much. Stretch or meditate. I feel like anytime you're like, hi, like telling anyone you're like, yeah, I struggle with like anxiety and depression. They're like, have you tried deep breathing? I'm like, you should try to eat healthy, well-balanced meals while you're working a bajillion shifts back to back. You don't get to eat while you're at work though, because we don't have enough staff for that. So good luck. You should exercise regularly because you're definitely not exhausted from working with COVID. You should get plenty of sleep while you're not doing all these other things. You should avoid excessive alcohol, tobacco, and some substance abuse. Okay, yeah, you should probably do that. You should continue with routine preventative measures, such as vaccinations, cancer screenings, as recommended by your healthcare provider, except they all got shut down by the CDC, who said we shouldn't do this right now. And a lot of people can't afford it. Again, go watch my healthcare deep dive. Get vaccinated with the COVID-19 vaccine. Make time to unwind. Try to do some other activities that you enjoy, even though one of the symptoms that you're doing this for is that you lost all interest in activities. So go figure that out. Connect with others. Talk with people you trust about your concerns and how you're feeling, unless it's on social media with the other angry nurses. Do not do that. Connect with your community, unless it's the angry nurses, or faith-based organizations. While social distancing measures are in place, try connecting online through social media or by phone. So I'm assuming that they're going to provide that because earlier they said that they would probably provide that for you so that you have space to live and be happy with plenty of room to social distance. So that was just our fun reprieve. I just thought that gave me a really good giggle when I looked at it. Nancy says that is so wrong. It is. Is there any way Vanna says, is there any way to challenge the CDC? You can only push healthcare workers so far. This is ridiculous. I don't know. I feel like most of the country feels the exact same way. Leslie said, isn't it part of the law to have vacation every year? I don't know. Is that a law? I don't think so. That does not sound like an American law. Probably not. The US does not even offer paternity leave. I have hopped on medication during the pandemic. Yeah, everybody leave their antidepressant in the comments. What will happen when there's no one left to take care of patients? I don't know, but it won't be our problem. Cheers. Just kidding. Don't everybody leave, but really protect your mental health. And if you need to leave, leave. We're walking away in droves. They think it's bad now. I know. Students, if you're watching this, I have a nice video that I will leave in the bottom just so you don't become totally hopeless. It's all about for students who are coming into their jobs in the middle of this pandemic, like the good things, the bad things, would I go back and do it again? And I don't really know, would I go into healthcare? But just to provide you a little bit of it's not all bad. Right now just seems really bad. So just to put it into perspective. Um, Barb said, I have lost most of my PTO and sick time when my office was closed. Oh, good. So they closed and then they charged you your PTO. Good. LPN of many years, working in a multi-specialty clinic was not essential, apparently. That makes me want to harm people. I am so sorry. Grandma Heidi, I love your name, Grandma Heidi. I was a supply chain and also in housekeeping, working at different hospitals in Arizona and Wisconsin. When COVID started, I worked 1 year and that stressed me out too much. I had to retire early. I don't blame you. Meanwhile, we should continue to bring our 70-year-old patients for Medicare reviews. This, like we will, because those pay you a lot of money. They can still come in. They can always come in. It's going to be totally fine. The CDC is the ultimate gaslighter. That is also how I feel. Fernando, we're going to talk all about this in like 2 sections. I've supported the CDC until they made these ridiculous recommendations. And I think this is going to have epic, awful fallout in terms of public health. Natalie, the Wellbutrin ADHD Club. I need to get on something like that. But I'm worried it'll make my anxiety worse. But my ADHD lately is like, boop, that I have self-diagnosed because I can't afford to go to a psychiatrist. Fine. Lexapro saved my life. I am so glad you are taking that. Wow, this is why your nursing peer group is running virtual meetings. It's been so helpful for all of us nurses. That's awesome. I'm so glad that you have that, really. And I hope it's a safe place where you can actually talk about what you are actually feeling. Hi, Rhonda. I work with Rhonda. She's my favorite. Wow. Joe says, wow, dental hygienists planning on going to Columbia to do RN DNP. And I thought hygienists were treated like crap. Welcome to healthcare. We are funny though. We have some very nice dark humor. We're good people. Okay, let's move on. I promised I promised everyone. I was like, I'm sure it won't be more than 45 minutes. I never learn. Let me know if you guys are liking live streaming thingies. I was thinking it could be fun. Let me know. Do we like them? Do we not like them? Do we like watching them on the replay? It's probably going to be a really long replay. I apologize for that. So now that we've learned that we should all not talk to any of our friends and we just need to sleep and deep breathe, let us talk about how hospitals can manipulate the guidelines, because this is the thing that makes me the most confused, not confused, concerned overall. So like I said, let's look at this. The way they have worded things leaves a ton of loopholes. So allowing healthcare providers with COVID infection who are well enough, who defines well enough? That's my first one. And willing to work. Is willing to work like, will you come to work if I threaten to fire you? Because I don't think anyone's going to be like, yes, I don't feel good, let me come to work. I feel like it's going to be one of those like, are you well enough to return to work? And do you want to, or do you want to be fired type of situations? And that's what makes me nervous. Healthcare providers with mild to moderate illness who are not moderately to severely immunocompromised. And remember, they also updated the definition of moderately to severely immunocompromised. So you have to have at least 5 days since your symptoms first appeared. Most people still feel like crap 5 days after their symptoms appeared, and have at least 24 hours since you've had a fever. What if you never had a fever? What if you aren't someone that tends to run fevers? And your symptoms are improving, but like, who defines what improving is? Like, that's not usually in healthcare. We try to aim for things that are a little bit more like definable, like, hello, your white blood cell count is this, not like low-ish. It wouldn't run so well if we in healthcare didn't go by like absolute values and we were just like, you are like dying, sort of like, meh. We don't really have a way to define that. So I thought that was interesting that they provided no parameters for that. They just kind of said they left it up for interpretation, which allows the hospital to then interpret it however they will. And I almost guarantee that they will probably not put it in a way that's going to be favorable to us. Healthcare workers who were asymptomatic throughout their infection and are not moderate. And so asymptomatic people, and this might not be a popular opinion, but asymptomatic people, if you're asymptomatic and you have COVID and you have passed the days and the data is saying you're most symptomatic from day whatever to whatever, like, okay, I think this is how we're trending into like it becoming a normal thing. Because if you have a cold, normally you are going to go into work, you're going to get a cold, you're going to feel sick. Hopefully you call out, and then you're going to go back to work when you feel better. You're probably not going to be 100%. Let's be honest. At least I never felt 100% before I went back. I wore a mask. I was wearing a mask before it was cool when I was sick. You're still kind of coughing up a lung, but you don't want to use any more PTO. Your manager called you 12 times while you were sick. So I think we're trending in that direction. So honestly, like if you're asymptomatic and you have COVID, I think that's the way it's going. The part that made me mad again was if you are symptomatic. And now they're like, well, you have to come into work. And then this kind of goes back for like saying the same thing. This is going more into like healthcare providers are permitted to return to work before meeting all the conventional return to work criteria. They should adhere to the things below. Patients should wear a well-fitting source control. So patients should now, like if you're sick and you come to work, the patient should probably like wear a mask. And the healthcare provider should be reminded that in addition to potentially exposing patients, they should also expose their coworkers. So if you're coming to work and we're making you come to work, we're also going to guilt you about it. So say, hey, you could get your patient sick and you could also get your coworker sick, but if you don't come in, you're getting fired. So just like layering on like little bits of future therapy for us. And it's just great. Considerations for determining which healthcare providers should be prioritized for the option, for all of these things are going to be like the types of symptoms you're experiencing. Are they bad? Are they that bad? Again, do you need oxygen or you want a BiPAP? What are we talking about? The type of patients they care for. So, are you taking care of patients who are immunocompromised, which is like, oh, wait, the whole hospital? How are we going to then prioritize those patients? Like, that's going to be I'd like to see that list of like who we care about less. Like, oh, you're going into a nursing home, just go for it. Oh, are you going into the NICU? Ooh, I bet they probably like take a step back away from that. And they're like, let's think about it. So that's happening. Again, it's what they didn't say and how open-ended they left it, that if you're feeling better and there is a need, then you can go. Let's look really quick at crisis plans because they exist. Again, at least they exist now, but these are terrifying, especially when you look at how they define a crisis. Here is how they define a crisis. When staffing shortages occur, which pretty much is everywhere, healthcare facilities and employers, in collaboration with human resources and occupational health, may need to implement crisis capacity strategies to continue to provide patient care when there are no longer enough staff to provide patient care. Implement the following things. When staffing shortages, allow asymptomatic. So that what they're saying is when you can call it a crisis when there are no longer enough staff to provide safe patient care. And this part was the most frightening because what so many hospitals, I feel like right now, do not have enough staff to provide safe patient care. So what you are saying, they could literally look at this document and say, we are in crisis mode. And if you're in crisis mode, then this is allowed. Allow asymptomatic healthcare providers, who had a higher risk of exposure, are not known to be expected. Okay, they can go to work. Healthcare providers, they should still go in and they should get tested. But what about if they actually are sick? Well, if you're in crisis mode, healthcare providers with mild to moderate illness who are not moderately to severely immunocompromised can show up, like we had talked about earlier, as long as their symptoms are improving, they haven't had a fever in a day, and it's been a few days. But then it keeps going. Like if it gets even worse, healthcare providers who are asymptomatic throughout the infection and are not, if you're not moderately to severely compromised, you can come back to work even sooner, like 5 to 7 days after. Healthcare providers with I realized you probably can't read the picture, but I'm going to read it to you. It's fine. um, at least healthcare providers who are asymptomatic, they can come back. And healthcare providers with severe to critical illness and are not with moderately to severely immunocompromised. So I'm just interested to see who that would be. Like, who has moderate to critical, severe to critical illness, but is not immunocompromised at that point. Like, that would be interesting. They have to stay home a while. But if you have severe to critical illness, remember, you are ventilated. So you are ventilated if they categorize you as severe. So if you're on a ventilator, you have 20 days to come back to work. Don't worry. Good luck. And healthcare providers, it just kind of like goes on and on. Healthcare providers who are symptomatic, this is who they're going to test. And it kind of goes into like, but are you having resolution of fever without fever? Like Tylenol and Advil. Okay. Are you having improving in symptoms? Good. Results are negative. So this goes into like the testing. This. And again, I know I made it too small, but you can check out the link in the description. This goes into if shortages continue despite other mitigation strategies. So they've tried other things. They've gone and they've made their call out. Like they said, like, go hire more people. And they even got them licensed because they reminded them to do that. As a last resort, consider allowing healthcare providers. So say your unit's trying to hire staff, but they can't find any, which is happening all over this country, just in case you weren't aware. Allowing healthcare providers to work, even if they have suspected or confirmed SARS-CoV-2 infection, if they are well enough and willing to work, even if they have not met all the return to work criteria. Again, who is going to say, are you ready to work or are you willing to work? Because I feel like it's not going to be a super kind person coming out and saying, hey, how are you feeling? Like, the body aches get to you yet? Like, let's come back on in. It's going to be much more one of those situations where it's like, if you do not come back, you will not be coming back to a job at all. At least that's how I see this going. Let us see. We talked about how a crisis is defined. The impact on public health. So I think, let me go back and find who said it. Was it Fernando that said that this is a bad look for the CDC? Because yes, this is yes. I've supported the CDC until they made this. This is going to, I feel like all of this, all it has done is has taken a ton of people who typically supported the CDC, at least through most of this. Everyone's backed it. Most people that have backed the CDC so far, I feel like, are healthcare people who have said, I'm going to trust the science. I'm going to trust what you are saying. You are the maker. They kind of come out with like all the vaccine stuff. So obviously that's been, but we've said, hey, I trust you. This has made all of us who previously were like, I trust you, this is fine. Maybe there's like little things where you're like, I probably would have done that differently. And now you've lost all of them, all of us. Like, you have now made the one group of people who I feel like were in your corner and you've just stabbed them in the back. Like, and what is that going to say to all the people who, not only the COVID vaccine, but I feel like we have a huge, just like public health, there's a huge gap between like, even if we just look at vaccines, like there are already so many vaccine hesitant people who now, we were standing over here being like, look, like the data is saying this, it's going to be fine. It's going to be fine. It's going to be fine. And now everything that they have been saying, not that they're right in like, I really do believe the data behind the vaccines, that they're safe, but the place that it is coming from now, we're mad at. So we've come out and they know we're mad. And I don't think it puts us in a weird situation. Like at first when I saw this, I was like, do I even want to talk about any of this and address it? Because I feel like if we talk about it, we're acknowledging that this organization that is supposed to be in charge of like our public health, our infection control, our vaccines, is making a stupid backstabbing decision. And that's just pulling all their credibility, and that's going to ostracize so many other people. And ultimately I decided, I was like, no, you can't just like someone has to be held accountable. Like, we need to talk about this because this is not okay. We're just getting like healthcare people are just getting squashed and it's not fair. But at the same time, like, what is this going to do? Because everyone's just going to point it back and be like, you don't even like them. You don't like the CDC. Like, you don't like, you know, uh, I feel like no one likes the CDC at this point. And it's like, that's not good when that is your people in charge of your infection control, basically. So let me know if you guys agree. Like, where do you fall on that? Did you trust them before and now you don't? Like, where does that fall? Also, thank you, Captain Aiko, for the super chat. Said, I started watching your channel, was doing my prereqs. I just graduated nursing school last week. Congratulations. I love the progression and growth. Keep it up. Oh, thank you. And super congrats to you. Good luck on your NCLEX. Also, I feel like, again, to all my new grads, Bettina, as a baby grad, as a baby nurse, hello. What are ways in which we can protect ourselves and not burn out? Look at, first look at the video of, and I will link below, of my video I made for nursing students who are graduating in the pandemic. And like I said, I just kind of walked step by step of like, I went through a lot of the good things I've loved and then the bad things. And it's just going to be a personal decision. I will say, like, my experience won't be everyone's, and everyone else who has had an experience, like, it's not going to be everyone's experience. Yours might be glorious. Different areas that you work in are going to be much more suitable to like a different environment that might not be quite so rough. But like healthcare is also, it's just kind of a mess right now. And so I feel bad for everyone graduating right now because you're graduating into a disaster. Like, and I think knowing that in the back of your head, that like, now you know how bad it can get. Like, let's see if you like, can you get to the part where it can be like good again? Because I have a lot of good memories of nursing. The last 3 years have been, or last, like when the pandemic started, like it has been hard. But I have good memories before that. And I kind of hope that we can just kind of get back to that. I have a lot of good memories of being a nurse. I have a lot of rough, like things that were not fair, but I do have a lot of good ones. And to weigh them, like, I don't know, like if basically, essentially, you know, if I waited again, like I do not know if I would go back and do the exact same thing again. But I would not be the human I am today if I did not. So I in no way regret it. You know what I mean? But like knowing now what I know, I don't know because it's been hard. I don't know if I would do it again, but I think it will make you a better human. It will give you so much life experience so that even if you decide that it is not for you, it's going to open so many different doors. Like you can go and do so many different things. You can do so many different jobs within it. That it'll never be a waste if you decide to go in a different direction. And there's nothing wrong with pivoting. Like, you know, I am currently pivoting. I feel like I'm like pivoting a million miles an hour. I'm like, never mind. I don't really know what I'm doing. But it will give you invaluable skills. So I want you to know that I've talked to a lot of new grads who are like, why did I even do this? I'm like, just do it, try out a couple different jobs. Don't feel bad about leaving. Be able to just do what's best for you and what feels right. Just do the next right thing. And see how it goes. And then take your skills that you've learned if you decide this is not for me and go do something else. And that's totally fine. Cheryl said, I feel like I can't trust the CDC anymore. Exactly. CDC will never recover in our lifetime. I feel that. It is terrifying, Janice. That's a really nice way to put that. Bettina, great question. Don't take on more than you think for sure. Oh, this is advice for a new grad. Don't take on more than you think you can do for sure, no matter the pressure. Band together with others you trust too, and self-care, which is so vague. That's my opinion. I think the biggest thing with like self-care is just keep interests. Don't let your identity become your job. A lot of people, especially in healthcare, which leads into all of this, is you become so wrapped up in your identity as a healthcare worker that you forget that you're also like Liz. Like there is a Liz in there, and there's a Janice and a Leah and a Cheryl and a Joe and everybody in there. And you are not your job. You are not your profession. And just do the things to keep you still you. In the beginning, in that first year, it's like difficult, but like keep a few hobbies and just like do things that keep you you, because you are not like, unless like you're, you know, some people, their identity is very wrapped up in their job and it's healthy. But I always tried to tell my new baby nurses, like, when you describe yourself, I don't want the first word that comes out of your mouth to be a nurse. I still want you to have enough of a life outside of this. this is your job. This is not your life. So like, just kind of keep that mentality. Leah said, I used to trust them with the CDC and now I'm scared. Same. Aaron said, as a soon to be nurse, it all has given me such anxiety to start a career that I was excited about. And that's what I hate. I'm sorry if I squashed that. I struggle with that too on this channel. I'm like, do I talk about how it really is or like try to make it nice and happy? There's a lot of nice and happy out there too, Aaron. If you just, and like this goes back to protecting your brain with social media, you really only need to follow people, even if you like them. Normally I follow people that I really like, but I've muted them for now because I was like, I just can't, like, I just cannot at this moment. And a lot of them work in healthcare. I'm like, a lot of it was like toxic positivity. And like, I was just like, I don't need that right now. You're great, but I can't. So never ever feel bad, no matter how much you like the person. If I am making you sad or anyone on social media is making you sad, don't follow them anymore. Just mute them for a little while. BC, it feels like the hospital admins got the ear of the CDC, which makes everyone wonder if hospital admins can do it. Who else has the ear of the CDC through the pandemic? I'm willing to bet that it's the insurance companies. Yeah. The US healthcare system needs an overhaul. Yes, it does. And obviously, my YouTube series is the thing that's going to do it. At least that's what I'm convinced myself of. Of like the 1% of people that watch my channel that watch it. I appreciate you. Let me see. Liz, if you consider political leadership in the no. That's very sweet. I don't love the ANA or any of those things, ANP or ANCC. Maybe I would start my own and be like, none of those. I don't play games. I'm not good at the dance of all of it. I have, in the back of my mind, I've always thought like maybe one day once my kids are like all grown up, go into politics and I'll be like that other AOC, but more on the healthcare side. I'll just like say exactly what I mean, be for a very interesting demographic of people who like, I just don't play that game. But not right now. Scott, Dottie, and Zach said I worked 25-year career and never worked overtime. The rest between shifts is more valuable than time and effort. This excellent tip for new grads. Friends, don't pick up overtime. The money is not worth it. Work when you can, like work when you're scheduled. And then when they call you and they say, hey, we have these extra shifts, just say no. No, you don't need to provide an explanation. No is a full sentence. Okay. Just no. You burn out so fast. The money is so tempting, but it will just destroy your mental health. Bonsai Baby said instead they are hiring new people and giving them $10,000 bonuses rather than acknowledging the healthcare workers have been through the pandemic and giving them a raise. Yes. So I feel like this was the conversation that was happening. And then all of this happened. And that is interesting because it certainly shut everyone up and got them talking about something else they were more about. It's just upsetting. I'm scrambling to find prereqs and ways to pay for school before it starts. That is very difficult. It just feels like people aren't trying to listen to healthcare workers anymore. And it's upsetting. I agree. Let me see. Thank you for being honest and truthful and kind. I'm grateful for you. Oh, thank you. I'm grateful for you. Help me to see that I will be able to have a life outside nursing. Yes, I am a huge advocate of excellent boundaries. And I've only learned that because I have had units and jobs stomp all over me. So absolutely have excellent boundaries. Enjoy your life outside of it. And I think life will just be a little bit better. Jay Michael said, is the CDC not just responding to critical shortage that there is? What should facilities do when they are critically short and have to shut down? Where do they send their resident patients? I don't know, but unless you are the hospital administrator who refuses to pay people more and provide a situation that is just more livable and makes people want to stay, that's not your problem. And I think that is what they've tricked us all into thinking, is that this is our problem somehow. That yes, there's no staff. We don't have these things, but like, it is not your problem. And I want you to like really, really embrace that this is not your problem. This is not your hospital. Yes, it is very sad that these patients will not have care. They are not your director. Like while you're taking care of them, your responsibility, but like the hospitals, the CEOs are making a lot of money. Like hospitals, most hospitals are making money, a lot of it. Um, there is a lot of other money that is being spent on I'm trying not to like everyone knows um my leaning I'm not we spend money on things that are dumb or we could spend less money on as a country. um Maybe that could go into some of it to like pay people, make people feel valued. It's the same thing with teachers. Teachers are going to leave like because they don't feel valued, they aren't paid, they're not respected, so they're going to leave. Like we're seeing this in education. We're seeing this in all the fields where they kind of manipulate you because you're a general feeling person. Like you have a lot of empathy, so they trap you and make you feel like this is we can keep you by saying what's going to happen, where your patient's going to go, all of that. And J. Michael, if you are, he said, some of us are in admin. I don't know how you do it. I don't know how you do it. Go up to your person above and just say, like, this is what it is. You know, like there's always someone above you unless you run the hospital. And if you run the hospital, please talk to me. I have a lot of things to say to you. Let's chat. Rhonda said, I need the advice about overtime when I was a new grad. You're so right. The cost of the personality is not worth the extra pay. And it will catch up to you. It might take like a little while to catch up to you, but I would say usually within like 3 months of my new grads graduating, when I would tell all of them, like, just say no, don't pick up overtime. Just say no. And then they would be like, oh my gosh, that's so much money. And then 3 months later, they're like, Liz, you're right. I was like, I know. When you get crispy, not quite burnt out, remember why you became a nurse in the first place, the good you do, surround people with good people. That's also good advice. Go back to what makes you kind of like feel good about why you got into it. And if that changes, also be open to like that changing. So I think that's huge, is that we have to acknowledge that the reason you got into it might change. My reason for going into it certainly did change. I went into it because it seemed like a good idea at the time. I really didn't put that much thought into it. My mom was a nurse. I was like, I guess I thought I was going to go to med school, and then a resident scared the crap out of me. And so I was like, I'm not going to go to med school. That sounds terrible. I'll be a nurse, because I only knew of 2 healthcare fields, nursing and being a doctor. So my thought of going into it was like, that seems interesting. I enjoy hearing about medical mysteries. Now it's changed. Now I like patient education. So pivot. It's totally fine to pivot. I feel like you can totally hear my cold. My sinuses are descending. Let us see. So I think that's pretty much it. We have chapter 9. Oh, Scott's comment. There we go. Figured out how to make it go away. Final thoughts, friends. So in final thoughts, I am sad that I think hospitals are going to take advantage of this, and they have left loopholes. I feel like that is the biggest thing that's going to come away from this. I'm less sad that, they're talking about the isolation, all that. I think that, especially with what they released today, has kind of standardized itself. Again, I think the thing we really need to be worried about here, let me give you something to be anxious about, is the loopholes that people are going to find. And that hospitals are going to make people come into work when they are sick. So thanks for hanging out during this very lengthy review of this. Like I said, let me know if you ever, like, if you like hearing about more current, up-to-date things like this. This is obviously like, we could come on and talk about it. It could be fun. Or if you're like, no, I hate it. If you ever have any ideas or things that you want me to like review and talk about, let me know. I will link all of this down below. And like I said, if you want to go back and like reference any of it, I mean, I'm pretty sure you can find all the information yourself. I'll timestamp it. And then if you want to see more things like this, if we're just meeting, then subscribe and we'll do more. I'm doing like a healthcare deep dive series where we're talking about looking into like why our healthcare system sucks so much, because we all know it sucks, but like kind of looking into like why and how it got the way it is. And then I'm doing one on like, I have a few going, nurse practitioner jobs and like questions you should ask. And then interviewing healthcare people so that you can find a different job. I've discovered palliative care, and I'm like, I feel like I could do palliative care in the future. So that's kind of what we have going on. And then I try to throw some fun ones in. If you have anything you ever want me to like, react to or topics kind of like this. I kind of want to do like a TikTok reaction type of thing at some point, but I don't, or like a reaction to some, I don't know. I feel like everyone does reaction videos. I'm like, I don't know what I would react to. So let's see. Nurse Scott, did you see the new CDC guidelines for the general public change today? Their isolation time is less too. Yes. And that kind of ties back into like, I never cared about like the isolation time. I always figured that would kind of match up with each other. Mine was more, why are you making people come in if they're sick? Like, because I do truly believe that as this becomes something we see a lot more, the isolation times, it's just going to kind of become the same thing as like with a cold. Like, hey, when you stop having a fever and you stop vomiting, get your booty back to work. I feel like it's going to become that, but at least, you should stop doing those things first. And now they're blowing a hole in that, and it's not. Purple Cat said there are so many paths in the medical career, not just nurse and doctor, such a broad field. I know. Imagine my surprise when I got into it and I was like, what's a respiratory therapist? Like, what is all of this? And I was like, wow, I did not put a lot of thought into this, which is funny that now I have a YouTube channel about nursing because people are like, what inspired you? I was like, literally that meme of that person who was like, it seemed like a good idea at the time. That is me. That is me. They said, Bonsai Base, I do think the CDC is struggling like anyone else. They have no clue what to do after either. After all, it's run by human beings. So I, a week ago, would have agreed with you. When people gave the CDC a lot of flack, I was like, you know what? They've never been through a pandemic either. They're doing the best that they possibly can. They are just like muddling through it. They've never done this either. And that was until they came out with their statement on the 23rd. And I was like, well, that was dumb. Like, you obviously didn't even have anyone look at that was like actually worked in healthcare, because I feel like that would have raised some red flags. So they had me, and I had that idea of like, oh, you're having a hard time too. Like, I so remember when the pandemic happened and I was like, I don't know how to do this in a pandemic and transition our entire practice to virtual. And I had to figure that out, and it didn't go well, but like we muddled through it, and everyone had grace for us because it was a mess. But they lost that. So I'm done giving them that. Why don't you own your own practice? Because that sounds terrible, Joe. That sounds terrible. Sounds like a lot of work. My patients still couldn't afford care. That's why I mostly left primary care, was because no one could afford any of the recommendations I had, even if they had insurance, because they couldn't reach their deductible. So that would still be a problem. I don't love the direct primary care thing because then you lack access to other resources. That's a whole different topic for a different day. So that's why. Also, I don't like to work that much. I like having like time to do other things. And I feel like if I own my own practice, it's just way too much responsibility. I am not a business human. I am like a flighty ideas human. So I would open my own practice and then I would be on to the next idea by the time my first patient showed up. And that's not legal. They would get mad at me for that. Sarah says, I have some things you can talk about. I'll leave it in a comment. Oh, for sure. Thank you. Purple Cat's going to school to be a lab tech. That's awesome. It's Bittersweet said CDC cut half 5 days because 2 days before symptoms and 3 days after the symptomatic is the transmission window. Yeah. So basically they came out and they said, hey, we know most people are shedding a lot of the virus and getting other people sick 2 days before they even have symptoms, and then 3 days after. So let's just shorten it. Again, I never really had too much of a problem with that part. The problem was that they're letting people work with COVID. I agree with you. The whole system is effed. Yeah, they wouldn't let me call. I thought about it took me a long time to come up with the name of that series for our current healthcare situation. Because I was like, I can't swear, but all of my feelings have swear words. So this isn't good. Let us see. Sweet Colonel Smith said, Lecturio has been good for you. Now you do outlines. Yes, I do. If you don't know, I work at Lecturio, which is like an online nursing education company with Rhonda, who does the awesome lectures. And I do like it quite a lot. They let me be myself, which is nice. When I'm like, I'm going to do this. I'm going to do this. And they're like, Liz, pick one idea, Liz, calm down. Oh, True. Everyone doesn't want to open their own practice for sure. All right, friends. Well, this has gone wildly over my expectations. I very much appreciate all of you that were here. Um, Le- Lecterio loves Liz. Thanks, Rhonda. I appreciate all of you being here. And yeah, let's see how this rolls out. But those are my feelings. I hope you have a peaceful night. Go sleep, go rest and eat healthy, and don't go on that nasty Instagram with all those other angry nurses. What else are we supposed to do? Make sure to contact your employer about having them find you a new house that is much larger, so that you can properly isolate, even if you just have to isolate from your cat. It's okay. And yeah, have a lovely evening, friends. Thanks for showing up. Bye.